Saw a patient in the office yesterday, recently moved to the area. He'd been to a cardiologist either where he used to live or in this area. I'm not sure about that. But in the cardiologist, in their exam room, they had a screen up and down, turned this way instead of this way. And on that screen was advertisements for things that the cardiologist recommends. This gentleman's there trying to get his heart health fixed. And on the screen, I'm not kidding, is an advertisement saying, talk to your cardiologist about canola oil. So in the cardiologist's office, the doctor who's there is supposed to help you with your heart health. They're advertising and recommending seed oils. And then the cardiologist himself comes in and tells the person, the patient that we saw, you should be consuming more canola oil, more seed oils. I'm shocked by this. When is modern medicine going to get with the times and understand that seed oils are bad? Somebody's going to come out and say, not all seed oils are bad, and a little bit of seed oil is okay. Look, I agree. A tiny little bit once in a while is not going to bother you because you do need some omega-6s. But in the standard American diet, you can't be advertising. If you're trying to help somebody with their heart health, you can't be advertising in the cardiologist office for your patients to be consuming canola oil when their diet is already bombarded with pro-inflammatory omega-6 fatty acids. The patient, by the way, was thankfully intelligent enough to know that they probably should not listen to anything that cardiologist said. And he and his wife up and just walked out of the room. I'm sure they weren't rude about it, but they are not going back to that doctor. They didn't listen to a thing that person said. And I'm thankful for that. The guy's health is going to be better because he's not listening to that. You guys got to be paying attention to this. Lots of doctors, I'm not saying all doctors like this, lots of doctors do not understand what they're telling their patients because they're educated out of a pharmaceutical-driven system. They get their information about medications a lot of times straight from the drug rep, not even the research. And this isn't all doctors, so please don't slaughter me here on social media, but you've got to be advocating for yourself. You've got to be doing some research. Look for a root cause doctor who can actually find what's causing the problem instead of just manage your symptoms. That is what we do here at Magnolia Medical. We love helping people. I love educating people. I'm Dr. Dave Morris. Stay healthy, be well.